I can't walk into a general hospital and say that I want to get an IUD. And one nurse somewhere, one older woman is not doing like this.
Why did you have to call a nurse first?
Yeah, so me, I do not think that the doctor will have the audacity to judge me.
You think so?
I do. Me. No, I'm speaking for myself now.
I've seen the video.
I know, so I'm speaking for myself.
Girls that had contraception in one school and was on the internet. That the doctor has to escalate the matter. It was the doctor that did it.
It was a doctor. No, so I'm saying no, I'm talking of shame now.
Okay.
Like I'm saying, I do not think a doctor will have the audacity to shame me because I'm way ahead of you. I will shame you first. But that's just me.
Yeah.
But there are people that are not as bold as me.
Yes.
Right. There are people that when they walk into there are people that cannot. You want to buy a condom, you have to wait for everybody to leave. Boys inclusive.
Yes, very true.
Boys inclusive.
Very true.
Even the emergency post pill that you say, some people do not know how to say it.
Yeah.
Now, thank you for saying that it's an emergency, and it's not paracetamol.
It's not paracetamol. Thank you for that one.
Because now,
you know,
they even said that it's fake. So imagine
they take
go ahead. Is this a safe space? If you're seeing this, this is a safe space. 7790. You might be wondering what 7790 is. 7790 is a number you dial when you need clarity. Clarity on what? Your sexual health. Because I know you run away from it so much. So today I'm going to be talking to you about your sexual health. And I have in the studio with me, in my safe space,
Faustina is my name. I'm a nurse. I work with DKT International Nigeria. And DKT International Nigeria is into family planning and reproductive health. And of course, we are youth friendly. So we're talking about everything sexual health, contraception, and reproductive health today. And with, what's it, America, your name?
Osasbaby. I'm very big on talking about sexual and reproductive health. I mean, I started talking about it. I'm still always very skeptical to talk about it online because I know it's a sensitive topic. So I only talk about it when it concerns me. I don't butt into people's sexual. The most I would probably do is say, go and get checked. I won't I won't force you. I would not sit down and start dissecting what is in your body because it's still an uncomfortable conversation for me. And this is coming from me who did not get any
sex education
when
you're growing
exactly.
up.
So all I was told, as with every other children that grew up with me, some people might relate to this.
Yeah.
If you talk to a boy, you will get pregnant.
Talk is not talk if he touch you.
No,
you get.
If you have to talk before
before even touch you in the first place.
So, I mean, I never believed this because I was not stupid. You could not have deceived me. But my mom did tell me if you talked to a boy, you would get pregnant. And you know what I did? I talked to boys.
Did you get pregnant?
No, I did not.
Are you sure?
I did not get. For clarity, I
Yeah.
have never gotten pregnant. Yeah. But that's just me. That's just me. If you have, and your pregnancy was unplanned, I'm here for
probably
you.
You're a virgin married second. You get.
Yeah. This topic we tiptoe around it a lot.
Okay.
Sexual health,
Very
sexual and reproductive health,
Contraception,
STDs, contraceptions, IUDs. A lot of people do not know that contraception is not going to kill you. Most they think that it's going to cause a lot of things for you, stop your blood flow, going to.
Some people think it to cause malaria, and these are things.
If it's malaria, it's better
like
now.
Even said right, it's a very very not conventional topics, right? And especially among young people, they feel very very reserved talking about it.
Older people too.
Because of how they were brought. Yes.
Older people too.
Exactly.
I feel like young people are talking now.
Now
you see,
they are
older
talking
people,
now.
In fact, they say things like, "Don't sex yourselves." Like we don't use the right terminologies.
Do not sex yourself. That's the first thing because the right terminology starts with knowing the right body parts.
Yes.
Now we're still very skeptical of saying penis because you wouldn't allow your child to even say it because you feel like it's supposed to be a private thing, you know, you don't say it out loud. So we need to even start with the right terminology for the right body parts. Breast is breast, vagina is vagina. Do you understand? When people get to understand and appreciate their body for who they are, they'll be comfortable to talk about sexuality, sexual health, what they should use to prevent pregnancy or what they should not use to prevent pregnancy. And then that will also help them from going to the quacks or going out of context to places that they're not supposed to go to try to prevent, getting pregnant or to even get to know about the sexual health. Because truthfully, there's so much on the internet now, right?
Much.
And out of what you see online, I'll tell you, most of them are not true.
Okay.
Most are not true.
Okay.
You Google things, your friends will come online, they'll tell you about this one. If you use what will I even use that is very relatable to us here in Nigeria? Some people use cow. That's Yoruba word for
Alum.
Like an alum. They use that thing to prevent pregnancy.
How does that
After
work?
sex, they'll try to find a way to. I don't want to go into that, right?
The thing is that it's a very broad topic, right? But because today is World Contraception, I think we should focus on contraception.
Course,
because this topic, if we enter it now,
we will not finish.
we will not leave here today. But because today is World Contraception Day,
Yeah.
we're going to be focusing on contraception.
True.
First of all, what are contraceptions? Contraceptions, contraceptives.
Contraception, contraceptive. You can call it family planning. You can call it child spacing. You can call it pregnancy prevention. So that anything that you use, right, to prevent getting pregnant while you are having sex, as simple as that. And we have different options available for you to use. You can have the condoms, you have the male condoms, the female condoms that you can use. You also have the injectables, 3-monthly injection that can be used. You have implants, you have IUDs, you have for the men, the condoms are also there for the men, the male condoms, vasectomy are the permanent method that, that one for the men, and also for the female as well. Tubal ligation are also things that are when you complete your family what's it called, the limits that you want to have, you can go for the permanent method. But the reversible method are the ones like the implants, the IUDs, the condoms that you can use, and afterwards you can remove them if you don't want to continue with them again, or if you want to get pregnant, or probably you're in school, probably for example, are in school and you have like 4 years to finish school and you do not want to get pregnant in the course of your education. You can have something within that space.
What's the most popular one in our country?
What's a popular one?
Because I would say the pills, right?
Yeah, is not a real in sense of family planning as such. It's an emergency contraceptive.
Oh, okay.
Right, and people do that mistake a lot, especially our young girls, in the sense that if you have sex today, you take post. That's not supposed to be true.
Okay.
It's supposed to be what you use in cases of emergency. Say, okay, you were not on any method at all and you had sex unplanned, that's one. Or you had, say, you were in a contraception method and it expired that day and you could not go to get it. Or so you had sex and the condom busted, right? Something to prevent, or probably the person was raped in that case. So an emergency cases. When you now begin to use post pill all the time in your monthly cycle, it kind of disrupts your cycle. So you want to avoid that. So if you know that you're having sex on a regular basis, you want to go to the real family planning methods like your implants, your IUDs, or the oral pills. You have the oral pills that you can also use, or the condoms as well.
So there was this video that was trending, right? It trended a few weeks ago. This woman that was walking on the road, heavily pregnant, and then somebody took her to, I think her name is Joy, took her to the hospital. And I mean, in the video, she looked like she was ready to go. Joy took her to the hospital. I'm hoping her name is Joy. And when they got to the hospital, she gave birth to the child. She was heavily pregnant, gave birth to the children, but they were dead, like they were stillborns, right? And then in another video, it was shown that she already had children. And then it sparked a whole debate online. People were like, oh, you already have children, you should not have gotten pregnant. That, oh, poor people like to, all they know how to do is get pregnant. Some people like, oh, that they're glad the babies died because there was no way that she could have taken care of those babies. But everything was, if. It wasn't like they were preferring any solutions. Because, again, poor people do not have access to these things. A lot of comfortable Nigerians only started having access to these things because they only started knowing how to mention them, how to talk about them. Now, poor people do not know.
Yeah, so that's where we actually come in, and that's why our call center number is open for everyone. It's toll free 7790. You can call in to ask questions about reproductive health, sexual health, or contraception. Now, for the woman that had, in fact, sincerely, it's a very sad story, right? And we sympathize with her for losing her child or the twins that she lost, But if you're going to be very sincere with ourselves, right? If you cannot really afford to take care of a child, then you need to opt for a contraception.
So you think poor people shouldn't give birth?
Not at all. Like you said, she had children already. And what contraception does to you is not like you don't have children at all. At least you can space
Okay.
until you're able to attain some financial stability and say, okay, it's time for another one to come. But when you're still struggling, you can't even feed the one you have at home. You can't even feed yourself. You have to be trekking on the road and be going and someone has to carry. She cannot afford
how do you convince a normal Nigerian that has been raised in traditional sense?
Yeah.
Because first of all, Nigerians believe that children are gifts from God, right? A whole lot of Nigerians do not believe in abortions.
Yeah.
Right? They do not believe in wearing condoms.
Okay.
Men especially, because I think that men have this myth that they don't want to store their children in rubber. I don't know who told them that children that have not formed. So I don't think you can possibly come, because when I used to live in Fadi before.
Okay.
And my house was one of the newest houses there.
Yeah.
So every now and then they were naming ceremonies, because they kept on giving birth. And my house being one of the newest men, that I was living amongst people that were living in face me, I face you.
Yeah.
Right? I was struggling. Right?
But you had some level of awareness and...
I do have some level of awareness, but I was struggling. And I knew that I did not want to bring a child into this world. Right? But every now and then, there were naming ceremonies. There were children, cries of newborns. Now, I detested the holidays so much, because there was so many kids running around. And then people are still getting pregnant. Yeah. And if you attempt to ask them why, is either they are looking for something, or they have a number they want to get to. You want to get to 12, or I want to give birth because one will become a doctor. You understand? So already
they have girls,
and they want a boy, and then it keeps happening. Or like their husbands cannot just keep themselves off this woman. Now this is not to bash
at all,
people, because it happens to the best of you guys. Right.
So it's still back to awareness. But if you look at it critically, well, Nigeria is happening to so many people actually. It is because some of those people are not going to anywhere, they're not going to work. They are home. The man is staying at home, he's seeing his woman at home every now and then. She's running around with, wrapper and all of that. Before you know it, they're back to the bed. Do you understand?
I think it's job.
Also, that's part of it.
I think people do not just
people
have
don't
enough
really
jobs.
have what to do.
And the ones that have jobs, I think they are using sex as an outlet for their frustrations. Because you fight on the road today, and then you go back home and
say, oh yeah, let me come. And the woman should come and help me relieve my pressure.
So I think there's a whole lot of factors in.
There's a lot of factors.
You're a nurse, so I think you must have seen a whole lot of these things.
I've seen a lot of it. I've seen people like that. I've seen people that come to facilities that have 12 children.
12. From one womb?
Yes, one woman gone.
Like one person?
One womb, yes. 12. I've seen, and most time when we travel to the North World programs, and it's very common. They're not any judgment to those who stays over there, but that happens. Even in Lagos here, we've seen people like that comes to clinics and 7, 8, and you're asking what's going on, And some women feel that, that isn't the children to get their grounds. Like, the more children you have, the more, for those women, the more powerful, in charge of your home you become. Those things happen.
In charge of what home? Like polygamous? Are we talking polygamy now?
For some who are polygamous. For some feel like, okay, if you have more children, the man will not really want to go
outside
because you own the, And if you have, for those who are looking for boys, if you have a boy child, it means that this one can succeed your husband. So you own that. So those things happen. Then
people that
education is also part of it as
well. People that
too.
have a boy child, you don't see them stopping.
To continue.
Because they're looking for another boy. Because they don't want, in case that one dies.
Yes. So that's again, as I was about to talk about education, that's part of it. Education is part of it. Women do not understand the effects pregnancy has on their body. That's the truth. There's an effect for each time a woman gets pregnant. For each single time, the pregnancy gets more riskier. So the more you're pregnant, not to scare you, not to scare
Not scare me.
No.
I saw a TikTok yesterday of a woman that her face was moving to the side. They said she was having stroke.
Yeah.
She was pregnant. She was making a video for her husband. Her face was falling to the side.
Those are the complications of pregnancy. You can have postpartum depression are part of it, and on the rise now, right? Women are coming down with hypertension. I was in a program where we're doing as simple as vital blood pressure for women, and let me say out of 80% of those women that we attended to had a very striking high blood pressure of over 180 over 60. And when we begin to make investigation, we realized that they developed the blood pressure when
they were pregnant,
and afterwards it continued. So we have postpartum hypertension occurring, you have diabetes in pregnancy. Those are complications of pregnancy. And the more you're pregnant, the riskier the pregnancy is. So women need to understand that, first of all, it's about your life. If you lose your life in the course of the pregnancy, the man will marry another woman. If you even like you too much, say you mourn a bit, and some will not even wait too long.
I mean,
I've never heard of one that I saw it on TikTok, I think, where during the wife's burial, the man proposed to, I think, the wife friend or something like that. It was online. And we're like, they've been going out before now. So those things hurt. So the woman has to take responsibility for her own life, first of all, her own health, and seek help where she needs to seek help, and, get education. Do you have the 5 children? 4, it's a lot. So but if you're able to even take care of 10, no, we don't have anything about that too.
I don't think
if you have the resources for 10, no problem.
I don't think one woman should birth 10 children. But that's just me. Like I have my reservations, and that's just because I think that you should not put your body through all of that. Like,
I agree.
3 is enough. 3 is a lot to raise. 4 is a lot to raise, and you're adding 6, 7 more. But I mean, I have a core audience of young girls like me, right? Girls entering uni, girls that are still getting sex education as when you talk to a boy or when a boy touches you, you're going to get pregnant. Now, we have to, I think first of all, we have to find a way to decenter shame. Shame is a big part of why people do not talk. And I should not even be saying girls, because boys are involved in this. Girls are not sleeping with themselves alone. The boys are involved in this, right?
Yes.
But I'm saying
now.
Shame. Now, and this shame stems from the fact that there are people that are shaming them. Shame exists because people are shaming them. I can't walk into a general hospital and say that I want to get an IUD. And one nurse somewhere, one older woman is not doing like this.
Why did you have to call a nurse first?
Yeah, so no, I've not had. I mean, I do not think that the doctor will have the audacity to judge me.
You think so?
No, I'm speaking for myself now.
Have you not seen the video?
I know, so I'm speaking for myself.
Girls that had contraception in one school and was on the internet, that the doctor has to escalate the matter. It was a doctor that did it.
It was a doctor. No, so I'm saying, no, I'm talking of shame now.
Okay.
Like I'm saying, I do not think a doctor will have the audacity to shame me because I'm way ahead of you. I will shame you first. But that's just me. But there are people that are not as bold as me.
Yes.
Right? There are people that when they walk into there are people that cannot. You want to buy a condom, you have to wait for everybody to leave. Boys inclusive.
Yes, very true.
Boys inclusive.
Very true.
Even the emergency post pill that you say, some people do not know how to say it.
Yeah.
Now, thank you for saying that it's an emergency, and it's not paracetamol.
It's not paracetamol. Thank you for that word.
Because now, they even said that it's fake. So imagine
they take
God have it. God please.
Imagine you take fake. That's why you go for the modern contraceptives.
Modern contraceptives are IUDs. The implants.
The implants. IUDs, the implants. You have the pills, the daily pills that you take every day. You
subject yourself to that every
day. Yes, you can take
and then
every day.
Injectables
for 3 months. You have condoms can also be used. Diaphragms are also there that you can use. So those ones are the ones that are available. We have different variants of condoms now. Condoms are not things that you feel like before. Now it was only one variant, this Go Circle, that we used to know. Now there are different variants of condoms. So if you're just using one, there's some condom that you can even use that increase pleasure for both partners than not even using a condom at all. So those things prevent pregnancy as well, and also prevents STIs. And I will tell young people that, even married people, that if you know you have multiple sexual partner, please use a condom as well too, so that you don't have infection and you're transmitting it to one person and to yourself back again. And also, if you notice any infection, I always tell my girls, any infection at all that you notice as a woman, you're having some discharges, smelly and itchy, and you're taking your antibiotics, you've gone for a test and they've prescribed for you and you're treating it, please make sure that you also treat your partner as well. Because at the end of the day, you treat yourself, you're fine girl, you're gone about, it will come back again, it will infect you, and will start again from the beginning. So treat yourself and also treat your partner as well too.
Demystify
and while you're
something
treating yourself, please use a condom.
Demystify something for me. Demystify this for me.
Okay.
Do men upset women's pH balance?
Do men upset women? That's a very large question. That's big. Yes,
they do.
It's very possible.
Do Yoruba men upset women's pH balance?
Why are you in particular about Yoruba men?
No, I just want to know.
Male is male. Let's look at the male gender. Let's not focus on Yoruba men.
Okay.
Yoruba men, Igbo, Hausa.
Okay. Do Lagos men upset women's pH
Even
balance?
Lagos itself will upset your pH balance.
Oh, okay.
Even Lagos environment.
Fair.
You know. So yeah, they can. Even the woman can upset their own pH balance. Women are even, in fact, it's the woman in Gongon that is even the sole culprit.
How?
Women are dodging. Why are you dodging?
Dodging what?
Cleaning inside of vagina.
Speak about it.
Some women will just, okay, you have sex. You buy your feminine wash, you're washing inside. Some even wash with soap. You put your hand inside, get to the cervix, and you're cleaning.
Put your hand inside.
Yes, the
cervix.
vagina. Go to the cervix and you're cleaning and think you're making yourself
clean. Your cervix.
That's wrong. The highest place you should wash is just the outside of the vulva. That's all. That's fine. The vagina is self-cleansing.
I'm sorry, people are...
Yes, people are doing that.
Okay, well...
people are doing that.
Well, I mean, a song did come out that said people should use alum. So it upsets me a lot. It really upsets me, and I hear that people are licking ice cream off each other's private parts.
That's another way to even
upset your pH balance.
Yes, that's another way. Yes, it's another way you're doing it. So even use Tom Tom. You know Tom Tom. Tom Tom.
You use only why Tom Tom to do.
Because Tom Tom will give you that cool effect.
Tom Tom, hi.
So
call me.
So Tom Tom will go inside there and come out. Before you know it, next week she's coming down with infection. So those things also are things that can upset, your pH balance. And you just know that the vagina is self-cleansing. On its own, it will clean itself.
Okay.
All you need to just do is ensure that you do not have infection. And one thing again is that we don't always follow through with our drug regimen, like antibiotics. You take it for 2 days and you say, oh, nothing is going, you're stopping it. Come back again.
I'm guilty of that one too, but like it's with every drug, to be honest. Even my malaria drug.
Worst of antibiotics. Well, the next thing again, you now carry the same pack again and take, and there's antibiotic resistance. So when you go back to take it again, it can't work again. That particular antibiotic can't work because the bacteria has again resistance against it.
So we have to go back to the doctor.
You have to go back again, do a test again, and I'll do another drug sensitivity test to be sure that that particular drug is good for you to use afterwards.
So the reason people repeat their drugs, for very obvious reasons, money. A very huge factor.
Yeah.
Right. People do not like going to the hospitals, and when they do, it's like they want a one-off. Right. So people do not know that they're supposed to go back if they do not finish their drugs. They don't know they're supposed to take the drugs anymore. Even I did not know. I found out as an adult. Yeah, I did not know. I've had drugs in my house that you
just go and take and
and this is safe for painkillers, right? I'm talking actual drugs like malaria drugs, right? So I found out I'm not ashamed to admit that I found out as a doctor, right? But people do not know that their body grows resistance to these things, and I think that these are things that these are conversations that we should keep having over. I mean, Aproko doctor has mentioned something like this before, but like these are conversations that we should keep having over and over again.
It does, So you should even start having it when you go. There's not how you should go to a clinic and come out. We don't tell you those things. They should be able to tell you that especially for antibiotics, even anti-malarials, please finish through the medications as much as possible. And then the other thing is the prevention part, where you don't have to now reinfect yourself again. Because each time you keep reinfecting yourself, you get to a point that antibiotics will be looking at you. Which one am I going to? Doctor will be looking at you. Which one am I going to give this woman again? Because last month you took ceftriaxone, today again you're taking ciprofloxacin. So it's a lot of it. So for your own health,
don't mention the names.
Okay. All right.
Don't everybody self-medicate. Yeah.
Okay.
So demystify something else for me.
Okay.
IUDs make me add weight.
Ooh, do they think so?
Implants.
Implants
make me add weight.
So implants could be what people say that, right? And it's very, very false. Implants doesn't make you add weight, right? But what I will tell you is that what makes a woman add weight for every woman or even man is what you take in. What you take in, the body gives you what you give to him or itself or herself as your body is. So you give me carbohydrates, I'll give it to you as body fats. If you eat late at night, you're eating junks, I'll give it back to you. See it in your eye that tummy is fat, your tummy is growing bigger, you're not working out, your body should give it back to you. So it doesn't make you add up weight. It's what you're taking in that will make you add up weight. For people that say they tend to add up weight, if you look at them very well, probably had a potential. They're already on the bigger side.
I don't think so.
You don't think so?
I don't think so. I mean, I've seen people, and I've also heard people say that IUDs, implants, make them have mood swings. Like makes them usually very moody, right? Okay. So I've had people depressed out of.
Depressed?
Yes.
Serious depression?
Yes.
For mood swing, implants are progestogen, and every woman has a level of progestogen in your system. You have progestogen, you have estrogen as an hormone in your system. And if you notice that when you're close to your menstruation, you have mood swings, you have premenstrual symptoms, that's the same thing that you might experience with the implants, because they are the same hormones that your system already has, the artificial hormone that are used in producing the implant itself. So you might experience a bit of mood swing, just like you experience when you are close to your menses. It's not what will make you depressed, please. If you're depressed, then you are not, please look for help. Yeah.
Okay, so if I call 7790.
So 7790, if you call 7790.
Are you telling me now that if I call 7790 and I tell them that my IUDs make me depressed,
so yeah,
they would be able to handle it?
So your IUDs, in fact, IUDs are not hormonal.
IUDs implants, to be clear.
So no.
IUDs are different from implants.
They're different from implants.
Okay,
so
what are IUDs?
They are intrauterine devices. They are the ones, they are copper. They're the ones that
looks
go,
like
a T.
Yeah.
So they go into the uterus.
They go where?
Into the uterus. They're inserted. Why is your face like that?
I don't know.
What happened now? So they go inside the uterus. They just stay there. They have no interaction with your hormones whatsoever, right? Now the implants,
can you bring them out?
Of course, not by yourself. You have to just go to, you call us, we'll refer you to our partner clinic, 7790, refer to our partner clinic. You can go there, they'll insert for you. We have trained doctors and nurses, partner clinics.
So apart from having that pap smear thing inserted into us, we still have IUDs. We're not going through enough.
But pap smear is not painful now. It's not that painful. Like, it's not that painful.
Hey.
It depends on your pain.
Hey.
Because mine was not that painful.
Pap smears are
I did
painful.
mine get this year. It wasn't that painful.
Pap smears are painful. They're embarrassing. They're annoying. They're cold.
Wait. The only thing you're going to feel is when you're going with the speculum. That's the most likely thing you feel uncomfortable about. That's it. After that, you just go in, clean, and you're out. And everyone should do it. Everyone should do it. It's very important, right? So
of course, every woman should have a pap smear. But I think there should be an easier way because it's painful.
Which easier way do you recommend?
I really do not know.
The only way.
Maybe let me
see open. And pee and bring it out.
I don't even know. But we should find something because by 2025. But back to you've said
the implants and the IUDs, yeah.
So the implants are now what?
The implants had the hormonals. They are just, like I said before, they're made of progesterone, like you already have. Small rod you put in the hand there. So they're in the hand here. They can last for up to 3 years, and you're good to go with them. After 3 years, you go back to the clinic and they'll remove it for you. in your goals. For that 3 years, you're not pregnant. You can't get pregnant. Because you know what happens to you now?
Are you saying it's 100% foolproof?
I didn't say 100%. But I'm saying that 99.999% effective. Yeah.
Okay. Family planning.
Yeah.
We talk about women. We say do this. We say do that. We say
everything's on the woman.
Everything's on the woman. Where does the man come in? Because you know men are not willing to get vasectomies. Right?
You see,
their myths surrounding vasectomies, they feel like it makes them less of a man. It takes away their manhood. Right? Men are not willing to get vasectomies.
Yeah.
And even to convince men to wear condoms, it's already a problem.
One.
Do you not think that this birth control in question should be for the men?
100%. 100%, I agree with you. But that but should not even be a but, actually. I agree with you, should be, you know. But you see, if you look at it very well, who carries the pregnancy?
We're the ones.
We're the ones.
So I'm saying, if you give men birth control, you stop the potency. Don't even stop only the potency. In fact,
because the man knows they are not the one carrying the pregnancy,
they will
now inside their food.
Do we consider grinding inside?
They will not now know it.
Grind inside their food.
They will not eat it.
Because it's our bodies, you get to call the shots. Our bodies are changing.
Yes,
so you get to call the shots. But I mean, I feel like if you grind inside their food, they crime because they have to be aware, right? That's the equivalent of drugging them.
Yes, very.
But how do you get men? How do you come? You're in this line.
Yeah.
You walk. I know you've seen mostly women.
Yeah. I've seen women. I've seen men.
Do you guys educate these men?
Facts.
And do they listen?
Thank you, because this conversation for the men is something that we need to really talk about as much as possible. Because I tell people that during the sexual intercourse, it's both of us that are doing it. I don't even enjoy it most. Statistics has it that men enjoy sex more than women. You know, so why?
What do you say?
Statistics has it that men.
Oh yeah, you're right.
Enjoy sex. How many women get orgasm? Like, what's the percentage? You know, they'll do their do and they're off and all of that. So at the end of the day, we are still the one that comes back to try to prevent it. The truth remains that men have to take responsibilities. They have to take more responsibilities. There are other options available for them to use. That's why located in Nigeria, via our call center 779, we have a lot of different variants of condoms. That's if you now say you don't want to use condom, I don't like condom, I want skin to skin. We have something we can give to you that is skin to skin, that is almost like skin to skin. I don't even feel like you're using a condom at all. You know, if you're saying that, oh, this and that, we have 3-in-1, Fiesta 3-in-1. Let me put Fiesta, right? You know, it has contour, it's dotted, it has some dots on the condom so that increases pleasure for both the partner. So men uses that condom and be like, I don't want to go back again. I'm not going back. I want to keep using condoms. So those are the things you're putting in place, or at least try to see how we can encourage the men to. And then the second thing is, as much as possible, you have to work with your partner to take a method. If she's taking a method, assist her. If it's the pills she's taking, at least you can remind her that, okay, have you taken, your pills today? All the support are necessary because we are in this together. If we are in this together, then I'm the only one doing that, means I'm just on my own. So that's the things, but we're hoping that with more education, our men will come around. But if you're not coming around, we also need to take responsibilities as ourselves, because it's you. At the end of the day, you're the one that will come down with complications, you're the one that will come down with pregnancy that you do not want. And at the end of the day, you now want to go and look for where you're going to, abort. And the rate of abortion is high. You forget that they tell you that it's illegal. It is, but
of course
the rate of abortion is high.
The only thing is that it's illegal because of the illegalities, there are a lot of back doors and people do not get proper aftercare, which is another topic entirely. See,
people do a lot of things.
All of this are topics that you have to properly sit down to dissect one by one. Right? Exactly.
People do a lot of things to try to remove unwanted pregnancies. I've heard stories of people using. Don't hunger.
I really don't want to believe.
Let's not hear about it.
I do not want to believe that that's a thing. People have said it, but I don't want to believe that it's a thing.
It's a thing. It is. And the question is, why do you have to go through that when you can actually prevent?
Because I also heard, this one happened to a close family friend of mine, that the baby had died inside, and they had to bring out the remains of the baby, so they had to heat iron put it in so that they could.
She went through a very bad route. That's a quack. That's not how it's supposed to be done.
Okay.
You know.
But these things happen because we do not have adequate.
Yes, it happens. They go to people once people get, because it's not legalized as such in Nigeria, except there's some particular reason that they can do for you in some facilities, right? But because it's not legalized for all conditions, people go to the back doors. They take what they're not supposed to take. You know, they'll dodge. They will use things inside, irons, to try to scrape down the baby. All of those things that can even put. I remember one that was very sad, was rushed to the hospital while we were working. The girl had bled and bled and bled. She was home. She took some drugs that she was thinking that maybe because she's bleeding, it means that the baby is coming down. And she was bleeding for almost 2 weeks, and she thinks it was still she was completely anemic. When she came to the facility, she was almost gone. The place had to transfuse the blood for her. She died.
She died
on the spot. You know, so those are things that we see, and we're asking, why don't you prevent unwanted pregnancy? Why do you have to wait till you're pregnant before you're looking for a solution to your health, and you're putting your life at risk? If you die now, just shout 1 minute silence, they will do. That's all. If they like you enough, if you're even big enough for that to happen, and you're gone and you're forgotten. So we need to really take responsibility of our health as women, as men who are in the relationship. Please, it's very, very important. And that's where 779 is very, very important for you. You can call us, and then you call the number, you refer you to the nearest facilities, and you have trained people there who will counsel you ahead of time when you call, and they'll give you the options that is available that is best for you and the one that you're medically eligible for to take.
Okay. So I know you're a nurse, right? You're in a dramatic profession.
Very dramatic.
Very dramatic profession. And I know you see...
Oh, beautiful.
You see people coming and out. Right. So I'm always fishing for stories. What has been your most dramatic experience yet with couples?
Couples? Do you want to hear? Do you
Duh.
want? Okay, so for couples, the most dramatic situations, questions is one. Let me start with the questions. Is they'll tell you, the man will tell you, "Shay, if I have contraception now, I hope it will not affect." I don't know why that gender is very, very selfish. I don't know why they are. Shay, it will not affect sex. That's what the man is thinking of. That's the first thing, And the woman will be like, I hope if someone that is still planning to have children, I hope it will not affect my fertility. Will I be able to still get pregnant after I stop any contraception? Those are the questions that comes with if it's couple coming together for contraception. And of course, you can always get pregnant after you stop a method. They are reversible contraception. Once you remove an implant, within a month, if you want to get pregnant, you can get pregnant immediately. IUDs are very, very fast, easily reversible. Your implants, your injectables as well are easily reversible. I was also seen in a situation where a couple dragged the man drags the wife to the facility and say, "Come and remove it." Maybe the woman had done
an
implants before. I said, "You want my wife to become promiscuous? Give her an implant. It means she's going to be going out and sleeping with another man. I will not know that she's sleeping with other men. Come and remove it." And the woman will come with the husband. And truthfully, respect couples because they took the vows, But the question is, madam, do you really want to remove it? Because contraception is reproductive health rights.
Yeah.
The woman has a right to her body, what she wants to do in her body. So we ask the woman, do you want to remove it? And the woman is saying, go ahead. Do not have any choice.
What she's under duress? Remove it still?
Yes. We will remove it because she has said it, But there's women that are wise.
Are these questions asked in front of these men? In cases where it looks like they are under duress, do you say, "Sir, excuse us"?
So we do counseling, couple counseling for couple, right? But we're also very sensitive when we're talking to couple. We also do individual counseling as well. So if we do couple counseling and we are fine, we'll do individual counseling for the woman and say, "Okay, madam, now let's talk as women. Do you want this? Is this what you really want?" And some women will tell you that, sincerely. Some women will tell you, "See, I know my husband. I know my partner. if I keep this thing now, it's a problem. Remove it. Give me what you will not know about. Give me an injectable.
Okay.
You know. But what we actually advise is you talk to your couple, and sometimes we'll talk to the man and say, yeah, Mr. Man, come and sit down. Let's discuss it. If this woman dies today, gone, sure you'll be happy about it.
I think so.
Will you be happy about it?
I think they
you
will.
know? And some of them will come around and say, okay, let's let her try and see. If it's not working, we'll come back. But, you know, we'll also try to see how we can talk to the man together and then the woman to make a decision about whether she wants to keep it or not to keep it.
So, I'm young. Alright. I don't care how old I am.
Beautiful.
I don't care how old I am. I'm still young. But you're people that are younger than me. Right. Now, we've said decenter shame. It's going to take a lot to decenter shame. There are some people that have to scrape money to be able to afford to go to hospitals. You've mentioned a lot of contraceptive methods. Now, which is the easiest, the most available, and the easiest to manage for somebody that is younger than me? Now, imagine somebody younger than me with a tax bracket of, say 1,000 naira to 100,000 naira.
Okay.
Right?
Yeah.
So which one is the most available, most manageable?
Okay.
Easy to manage. Not
Easy to manage,
easy to manage.
If you're looking at
And most recommended.
yeah.
That is not emergency post pills, because now
course.
we have to say we've established that emergency post pills are for emergencies
emergency.
only.
we don't have most recommended.
Okay.
Why? Because your body is different and my body is different. So if I had given Madam Hey this one, doesn't mean that you to be the one that will be best for you.
Okay.
So easily affordable, right? In fact, I would say I don't want to mention a particular one because you know that people feel like, oh, I'll go for that one, right? The pills are not expensive. The daily pills are not expensive. You can get them for as low as 1,000 naira in pharmacy, but you have to go to a facility clinic to get it. And in Lagos State, family planning I think is generally free. But if you can't go to the general hospitals, that's where the partner clinics, our 7790 comes in. When you call the call center 7790, we have partner clinics available that we can refer you to.
Okay.
And then we in the call center also do campaigns for young people. We do e-voucher campaigns where we give out free contraceptive options for you. You can call us if you don't have the resources. When we are doing the campaign, that's when you call us. When we are doing the campaign, we can now refer you to a partner clinic and you can go and get as low as 5,000 for implants, 6,500 for implants, 5,000
And these implants, the ones that last for 3 years.
For 3 years, and 3 years is 5,000 for 3 years. It's a very good. It's a very good buy. So 5,000, 1,000 for the pills, 1,516 for the injectables. When we are doing the campaign, you can easily get them when we refer you. But sometimes we do campaign that is completely free. That when you call the center, it's completely free. You don't have to pay any amount of money. We just have to refer you to the nearest facility, counsel you, and you get the options of your choice for free. Question.
I'm asking this question. I know the answer, but there are people that do not know this answer. I'm going to say this question and I'm going to read a story for you. The question is, does withdrawal actually work? That's the pull-out method, right? So, do I read this in third person? Amaka. Okay. Amaka is 27. Amaka is my age mate.
Okay.
She's 27. She's dating somebody that she really likes, but she's been wanting to get on birth control.
Okay.
But she's dating a traditional Igbo man. She's dating a traditional Igbo man, and he has not done smoothing on her head yet.
At all.
Right. So she's not ready for children. She wants to get on birth control. She talks to her man and he says, oh, he would pull out. A traditional Igbo man. To put it into context for you, I don't think traditional Igbo men believe in condoms either. Right. So they either put their seed inside you or they remove it. Now she says, our partner insists on pull-out method, right? But she doesn't want to continue. They've been doing it, she doesn't continue. She says he has been accusing her of not trusting him because she says she wants to use contraceptives. Now, she's raising questions of her own, right? What if this man is impotent? Because the pull-out method is obviously not 100% certain.
But she's not been pregnant.
She has never been pregnant.
So she's thinking maybe he's...
Yes. Now she's thinking he's impotent. But she can't bring it up. because again, traditional Igbo man,
Yeah.
right?
Yeah.
She can't bring it up.
And she wants to get pregnant, girl.
And she hasn't gotten pregnant. That's why she thinks it's
She
impotent.
thinks.
Now, she's torn between, you know, bringing that up,
Okay.
asking him to go for checkups.
Mm-hmm.
And if you've, again, reference to the secret life of Obasegi's first wife, 4 wives, men do not like to be told to go for checkups. Reference to Stay With Me by Abayomi, men do not like to be told to go for checkups. Right? So she's torn.
Yeah.
Does she stay with the pullouts? Does she
Stay with the pull-out
method? Ask for them to go for tests to confirm that this person is fertile? Because remember, she's going to marry this person if it happens.
Yeah.
Right? Now, 2 questions. Does contraception,
One.
does pull-out work?
Yeah.
Should she go for this test?
Go for a test?
Should she question his
Our
fertility?
question is, does pull-out method work? You see, that's where the problem is. It's people like, let me call the man Emeka, right? Call him Emeka. It's like Emeka that will make people feel like, pull-out is working, because in a different context, some people will be happy that, oh, I've been pulling out for 3 years now, nothing has happened. And they've forgotten that it takes a woman just a day to get pregnant. Other days in the menstrual cycle, you may not likely get pregnant. So it's possible that you're pulling out in a safe period, and you are thinking that, she's not pregnant. So when you're pulling out, she's not ovulating, and you think that it's because of your pull out. It's not your pull that is doing anything. The day it will happen that the baby enters, the pregnancy enters, it's going to be twins. That's it. And that one,
and it seems to look like you. Like you, the man.
It's going to be twins. So pull-out methods are not effective. They're not reliable at all. At all. They are as low as 65% effective. They are not reliable. So we tell people that please do not bank on it. And for the babe that is saying she wants to go and test it, I truly don't think it's a matter of testing this fertility, but you can't do the test. It's fine. In fact, you can do it. Of course, you have to test and see yourself and
not possible to do it without the man knowing.
Do it. Carry him to the clinic. Do it. Say you are going to do general body tests, and they'll test all of your body and everything that needs to be done. So pull-out method is not effective. If you need a method of contraception, just go and take one. Let's use a condom if you're not ready for pregnancy.
Demystify something for me. Family planning is for married people alone.
Mm-hmm. They said so.
They said so.
They have been saying
so. It's not true.
They have been saying so.
So it's not true.
Is it only married people that have sex?
Oh, it's only married people that have sex.
I say it's only married people that have sex. That's the question.
I mean,
like we said before, family planning, contraception, whatever you do to prevent pregnancy while you are having sex. So if someone that is not married, single, you have a right, and it's a reproductive health right. Like you have a right to contraception. Nobody should be holding you and say, you shouldn't even be ashamed to ask for it, So go to the clinic and get it. It's not just for married people alone, it's for everyone in the reproductive age, grade.
For people that already have families,
okay.
I mean, I think they can still do family planning, right? People that have families putting children in harm's way, and by the people in question are people that are underprivileged.
Okay.
To prevent these babies from dying. Now, it's the video of the woman that her babies died in a very, very horrible situation. Very sad. Right? And I'm sorry, the twin. Yeah. I'm sure it must have meant something. It must have been something significant to her. Right? So, people that, most of these people do not feed their kids the required. Most of them don't even have breast milk.
They don't even have enough. They don't even have food to. It takes what you take in to produce the breast milk. You need to eat enough for you to produce breast milk.
Most of them are they're not wearing the right clothes, the right some of them don't even wear diapers.
Mm-hmm.
Right?
Yeah, very true.
So these things they're quite telling, right? Because now they have to rely on other people to take care of these children. And when you tell them family planning, it looks like you're looking for their trouble. They will look at you like you're doing too much by asking them to plan their families. So, you see, I think there's so much work to do.
Yeah.
So much work. My core audience right now are people that are within my age range. So there are people that we're still at the stage where, we've not put our head there yet.
Yeah,
We're still learning from each other.
Yeah.
We educate each other about periods, educate each other about our sexual health. Currently, fibroids. Next month we have the breast cancer awareness month. There's going to be a lot of sensitization about that.
Okay.
Now this is today being World Contraceptive Day. You know, I've learned some things. Right? Even though I still do not believe, I do not agree. I do not completely agree with you about IUDs and implants not causing mood swings.
I told
not
you,
being because of mood swings.
I told you how it works. I told you how it works.
That's your medical term.
Now I told you how it works. I didn't tell you. You said depression.
Yeah.
It does not cause depression.
There are people that have been depressed after getting implants.
No.
I've heard stories. I've heard people say that they had to remove their IUDs because to go back to normal.
If you understand what depression is, clinical depression is a very big word to use. Clinical depression.
Okay, maybe not clinical.
You need to have to be diagnosed with that. But for mood swing, like I said, it's similar to your mood swing that you have during your period. Some people experience.
Are you sure it's times 2 now?
You know, it's not times 2. Some people experience those moods. Even when you are as a woman, you know it.
Yes, I do. So that's what I'm saying. Like some people are saying that. Some people are saying that they're having out of body experiences. But yes, now because already you know what your mood swings feel like. Now you add IUD to it.
No. It's not something that is what you're talking about. One thing you need to understand is that people exaggerate things when it has to do family planning. They exaggerate. Some people will tell you that I am spotting, even if it's your friend. If it's not you, did it happen to you?
I've spotted before.
Happen to you? No, I mean for the
IUDs. Like I said, we share stories, but I don't think you should say that.
That's the thing.
But I don't think you can say that women are exaggerating, over-exaggerating.
People over-exaggerate when it comes to medical. So when it's medically inclined thing, a woman can tell me she's bleeding. But at the end of the day, when I access her, she's not bleeding, she's spotting.
She's bleeding.
What bleeding is
because what bleeding is to you is not what it is to us. So if I say that I'm bleeding, if I have a cut on my, if I have a cut on my hand,
exactly,
and I say I'm bleeding, it means I am bleeding.
If you don't
see it as bleeding because you're a nurse, right? If I say I'm bleeding, it means I'm bleeding. If blood comes out of me,
so what I'm trying
when
to
I don't
say
want it to come out of me, I am bleeding. So
I
do not think that is an exaggeration.
We're actually on the same pedestal, right? When you say you are bleeding, when I see bleeding, I'm seeing you, boom, blood is coming out, and that's the same thing. That's the same thing that has to do with mood swing. When you're saying depression, I'm looking at someone that is completely depressed, but mood swings are what we experience. You experience, I experience on and on. Some days I am like, don't talk to me. You know, that's some days I'm like, I'm all friendly and jovial. So those things happens. So it's not like when a woman will tell you that she's having mood swing and you're feeling like she's depressed. I'm trying to make you to understand that it's not what's as worst as making you to feel like she's experiencing. It's not. Any side effects you're experiencing, if you're having bleeding, for instance, if you're spotting, you know, if you're having mood swing.
Because of the drugs that they gave me for my fibroids.
Yeah.
And I had to stop.
So if you're, why do you stop? What's the name of the drug?
I don't know.
Yeah, but
like I was spotting for 2 weeks.
Oh.
And that I wasn't eating enough for me to be bleeding that much. So my doctor had to stop. Why are you taking the
drug for fibroid? Was it to reduce the bleeding or to stop the pain?
Pain.
For the pain?
Yeah.
That comes with it. Okay, so that means they give an hormonal drug. It's going to be an hormonal medication.
And if I bleed in ways I don't want, I'm going to be depressed.
Yeah.
So you see?
Yeah, I see your point. But your depression is not as a result of the drug. You're just depressed because you don't like what is happening to you.
Yeah. So, I shouldn't.
So it's not as a result of what you're taking.
Okay.
You get?
Okay, that's fair. You're the professional. But
yeah.
Agree to disagree.
We agree to disagree.
Agree to disagree. Agree
with my point.
Okay. No. Agree with my agree to disagree.
Agree with my because I have backups. I have studies.
That's why I said. That's why I said you're the professional.
I've worked with several.
And because you know that we've had cases where women's situations are not taken as seriously. We tend to become.
You don't minimalize women conditions. When woman tells you she's feeling pain, I know she's feeling pain.
No, so I'm saying that we've had cases where women are not taken seriously in hospitals, and you go and ask for. You have to either request a new doctor or request a female doctor because you're not being taken seriously. And we've had people say that some doctors have preferred solutions like go and have sex to situations that are peculiar to them, right? So, again, a lot of things to demystify.
Yeah.
A whole lot of things to demystify.
I understand sincerely. I understand. That's why it's important for you to get, and it's not very easy now, sincerely, to have some medical people that can easily listen to you, right? I'm
Now?
on the field. It's not very, very common, but you see them. People are very busy, and I don't blame the doctors or the nurses. So one person is doing the job of 10 doctors. She wants to just finish and move. So why you want her to listen to you? She's like, next, they have 20 clients waiting for me, 20 patients waiting for me. Can we finish? So those things are things that also affect, because if you now go and say, I'm feeling pain.
That shouldn't be, because a doctor did that to my sister weeks ago, right? We had gone to do breast scans, and we took it to the doctor, and he goes, me, I'm tired though. You are the last person that I want to see. Please, I can't read these results. Go and do another test without going through it.
It's sad, actually. It's very sad. And some of the things.
And these are people that you want to convince to go back to the hospitals.
Issues in the line, because when she is tired like that and you want to go and want to do a surgery, God forbid, So those things are things that happen. People are traveling, those that are traveling, nurses that are traveling every day. They are moving out. You can go to a facility and you're seeing just 1 or 2 people who are going to attend to over 100 people. They will get tired. They're human beings too. They will get tired. So it's unfortunate, actually. So that's why call our call center number. Don't worry, you'll be fine. Just call 7790. You'll be fine. You'll be referred to a facility that everybody is stable. Stable hands.
Okay. I mean,
and they would attend to you, especially when it has to do with reproductive health, family planning. They will attend to sexual health, any questions you want to ask. Before you even start going to the facility, we have people that are already, the agents that train people who would counsel you ahead. If you want to book an appointment with the facility, they can book ahead for you and say, okay, go by this time. So you don't have to go and start waiting for them to, all of that to happen.
I mean, it has been quite insightful. So I always ask my guests these questions, and you have to answer honestly.
Okay.
Right, they're personal questions. So you have to answer honestly. What is your safe space?
What is my safe space? I'm not giving that a thought as such. I think that one will be okay, my book and my safe space. I like to read.
Okay.
So I just pick books and read, or go to the app. I have an app that I read from.
Have you read?
I was looking at the books, but I have not read.
Have you read Tomorrow I Become a Woman?
No, but I think I've seen it somewhere.
Oh, you should.
Yeah, I saw it somewhere, but I've not read it.
You're going to be so mad.
Really?
Yeah.
I would love it.
You're going to be so mad.
I'll check it out.
When you're done, read The Middle Daughter.
The Middle Daughter.
Yeah.
Okay.
I'm sorry to my set guys for you're going to be so mad at me for doing this, but yeah, read The Middle Daughter. Okay. So I think you should read these books. You would also have a full grasp of what we talk about when we say we're not being listened to.
Yeah.
You understand? I mean, great that there's a solution 7790 for us to call, but again, we need to be taken so seriously.
Yeah.
What is your go-to music?
Go-to music.
Your favorite song, that is.
Favorite song. I don't have anyone in particular. I like country music.
Yeah. What's your favorite country music?
Back in the days, I'm not sure you know. I like Jim Reeves. Welcome to my world. All those songs, I love them. Country music. It shock you, Abby. It shock you. You think I would say it's Skelewo? No,
I mean,
who
is Jim Reeves?
Oh, go and check it out. Sorry.
Jim Reeves.
Sorry.
Welcome to my world. Okay.
That's not my best song, but I love his songs. Yeah, I love country music generally.
Does ABBA count as country? Dancing
ABBA?
Queen, yeah.
I don't know what song that is.
Dancing Queen. I'm just trying to feel among you. That's what I'm mentioning. It's not country music, okay. What is country music?
Country music are like old blues, like blues.
Oh, I see.
They're like
I know nothing of that.
Yeah.
Sorry
too.
I apologize for that. I mean,
but I love that.
So this has been quite insightful, right? If again, agree to disagree, right?
Agree with you.
But it has been quite insightful. I'm glad that you've demystified a lot of things for people. But the gag is, as with everything, our bodies are different, right? So we always have to make sure that whatever it is that we are doing, are tailored to our bodies.
Yeah.
So you cannot go out and you cannot take recommendations from friends that are not trained professionals. So it's also why when people ask me for advice on their bodies, I always say go to a trained professional. This is the advice I'll give is in the capacity of what I know and what happens to my own body. And even if what is happening to my body is similar to what is happening to your body, you don't have the same reactions to things. Right? So always make sure that you see a doctor. If you cannot physically go in to see a doctor, you can always dial 7790 anonymously too. You can always call in and say that you want to ask questions, and they won't judge you. Even if they judge you, they don't know your name. Even if they know your name, they're not seeing you again. There's so much happening in this world. They'll move on from it, right? Nobody is ever going to come and
They
say,
won't judge you actually. It's not, you don't judge.
oh no, on 7790, if you go to the hospital and my name, you get some sort of judgment. Right?
They don't judge. Partner clinics, if they judge you,
No.
call back and let us know.
You handle that?
Yes.
Okay, great. So if you ever get judged, also remember, do not trust methods that have not been fully verified. And by fully verified, we mean 99.999 to 100%. Right? So make sure you stay safe if you're young. Take your vaccines, the cervical cancer vaccine, the HPV vaccine, the HBV vaccine, whatever vaccines that is important for you, take it. Men, it's not my place to advise you. It is my place to advise you because I'm a big sister, right? Take your health seriously too. Go and do that full body checkup. Checkup that you've been running away from. Men, women, boys, girls. Go and do those checkups. Okay? Your health is important. Do it so that we can turn up on Friday. Okay? Thank you guys for watching today's episode of This is a Safe Space. I'll see you in my next video, and happy World Contraceptive Day.
Thank you. Happy World Contraception Day. Thank you so much for being here, and please don't forget to call 7790.
I'll see you in my next video. Don't forget to like, share, and subscribe. Okay? I'll see you in my next video.
All right, bye.
Is this a safe space? If you're seeing this, this is a safe space.